Good afternoon everyone. Myself Dr. Kirti, Assistant Professor, Physiotherapy Department. So today we'll discuss about the biomechanics of wrist. So wrist is the distal joint of the upper limb, allows hand, which is the affixed segment, to assume the optimal position for prehension, that is grasping. So articular complex of the wrist, which contain two joints, that is radiocarpal joint between the radial head and proximal row of carpal bones, midcarpal joint between proximal and distal rows of the carpal bone. So radiocarpal joint is an ellipsoidal joint, and carpal aspect present two convexities, transverse convexity and antero-posterior convexity. So first we are having the wrist joint and second is the ellipsoidal as shown in these two figures. So ligaments are the collateral ligaments, which include lateral or medial, and anterior ligaments, which are attached to anterior edge of distal surface of radius and neck of the capitates, and posterior ligaments, which form strap posteriorly. So what are the function of ligaments? So during adduction, abduction, medial and lateral ligaments are active. Starting from the rest position, adduction, lateral ligament is stretched, medial slackened. During abduction, vice versa. So during flexion, extension, anterior posterior ligaments are active. So during flexion, posterior ligament is stretched, and during extension, anterior ligament is stretched. So muscles. So during wrist flexion, flexor carpi ulnaris and flexor carpi radialis are active, and this wrist flexion is assisted by the palmaris longus, and wrist extension is usually done by the extensor carpi radialis longus, extensor carpi radialis brevis, and extensor carpi ulnaris. Ulnar deviation at the wrist is usually done by the flexor carpi ulnaris and extensor carpi ulnaris, and wrist radial deviation includes flexor carpi radialis and extensor carpi radialis longus activation. Synergistic and stabilizing action of the muscles of the wrist, like extensor muscles of the wrist act synergistically without the flexors of fingers. Like during extension of the wrist, the fingers are automatically flexes, and to extend the fingers in this position, voluntary movement is required. So flexor muscles of wrist are acting synergistically with the extensors of the fingers. So when the wrist is flexed, extension of proximal follows automatically. So we are having the kinematics. The articular complex of wrist is basically having the 2 degree of freedom. So when these compounded with pronation or supination, so there could be the rotation of the forearm around the lower axis. The hand can be oriented at any angle to grasp or hold an object. So movement of wrist occur around the 2 axes, like transverse or sagittal plane. In the transverse axis, like flexion, the anterior palmar surface of hand moves toward anterior aspect of the forearm, and during extension, the posterior dorsal surface of hand moves towards the posterior aspect of the forearm, as shown in this figure. And during adduction or ulnar deviation, the hand moves toward the axis of body, and ulnar border forms an obtuse angle with the medial border of the forearm, as shown in this figure also. So axis of body and its lateral border forms an obtuse angle with the lateral border of the forearm. So in posterior axis, range of anterior posterior axis, it is shown. Range of movement of wrist and range of abduction doesn't exceed 15 degree of adduction. Is 45 degree of flexion and 85, and range of extension is also 85. So movement of circumduction, that is flexion, extension, adduction, abduction, takes place in 2 axes of the wrist. Thank you.